হ্যাপি দিওয়ালি, তার সঙ্গে পুরনো হলেও হ্যাপি শারদীয়ার শুভেচ্ছা। হ্যাপি শারদীয়ার শুভেচ্ছা না, শারদীয়ার শুভেচ্ছা, প্রথমেই ভুল বলেছি। যাই হোক, টুডেজ ডিসকাশন ইজ কার্ডিয়াক এরিথমিয়া। হোয়াট ইজ a cardiac arrhythmia? Define cardiac arrhythmia. Anyone? What is cardiac arrhythmia? An abnormality of cardiac rhythm is known as arrhythmia. Abnormality may arise from initiation or generation of cardiac electrical impulse and or propagation or conduction of cardiac electrical impulse through the specialized conduction system. Arrhythmia should be discussed on the basis of certain aspect. That means I want to say outline of discussion that should focus on the physiology of cardiac rhythm. Secondly, types of arrhythmia and their mechanisms. And lastly, therapeutic strategy for control of arrhythmia. Now coming to the original point, that is definition of cardiac arrhythmia. An abnormality of the cardiac rhythm is called a cardiac arrhythmia. Cardiac arrhythmia are the manifestations of the abnormalities of number one, initiation or generation of cardiac electrical impulse. Number two, propagation or conduction of the cardiac electrical impulse. সাধারণত কার্ডিয়াক এরিথমিয়াকে আমরা দুটো ভাগে ভাগ করে রাখি, ব্র্যাডি এরিথমিয়া অ্যান্ড ট্যাকি এরিথমিয়া। ব্র্যাডি এরিথমিয়া means arrhythmia with a heart rate less than 60 beats per minute during daytime and less than 50 beats per minute at night. Whereas tachycardia means heart rate exceeding 100 beats per minute. Again, tachycardia can be subcategorized into supraventricular tachycardia or tachyarrhythmia and ventricular tachycardia or tachyarrhythmia depending on the anatomic substrate of the conduction system. Supraventricular tachyarrhythmia arises from the atrium and the AV node or junction, and ventricular tachyarrhythmia arises from the ventricle. Now coming to the point of physiology of normal cardiac rhythm, origin of depolarization through action potential having stage 0 to stage 4. That is origin of depolarization, that means the base of development or generation of cardiac impulse starts at sinoatrial node. শোনা যাচ্ছে? Then transfer or propagation of depolarization or electrical impulse that occurs through the conduction system including atrium, AV junction or AV node and intraventricular. This is the sequence of the normal cardiac rhythm. A is the node, generation or origin of the electrical impulse and propagation through the conduction system. This is the atrium, AV node, and the intraventricular component. Pathophysiology of heart rhythm. That means derangement at any level described earlier would produce cardiac arrhythmia. Like depolarization origin defect, অর্থাৎ origin of cardiac impulse that occurs in SA node. Derangement of that function leads to sinus node dysfunction. On the other hand, depolarization, transfer, or propagation of or conduction of the electrical impulse occurs through atria, AV node, or intraventricular conduction system. In atria, derangement results to sinus node dysfunction. In AV node, derangement occurs to occurs for sinus node dysfunction as well as AV blocks. So, transport of depolarization may lead to sinus node dysfunction as well as AV block. Lastly, the intraventricular conduction system that lead to intraventricular blocks. Myocardial action potential, which is the basis of initiation of the cardiac electrical impulse. Action potential is the voltage status of myocardial cells or potential difference between intracellular and extracellular component of the myocardium. Transcellular migration of ions, that is ionic transcellular migration, produces action potential, then depolarization and repolarization sequence, and development of the cardiac electrical impulse leads to excitation, contraction, coupling, ultimately resulting in ventricular contraction and the mechanical function of the heart. So there is the conversion of electrical energy to mechanical energy. That means electrical impulse to cardiac contractility that are totally synchronized in order to perform the heart to act properly. Now, myocardial action potential has got 4 phases, 0 to 4. Phase 4, that is the resting potential. Phase 0, sodium influx. Phase 1, potassium efflux. Phase 2, calcium influx. Phase 3, potassium efflux. Phase 4, resting potential. This is the phase 4 resting potential. This is the phase 0. This is phase 1. 0 to 1, this is the depolarization. 1 to 2 are Plato phase, are part of the depolarization. Then starts the repolarization sequence like stage 3. So transcellular migration of ions, especially sodium, potassium, and calcium constitute the basis of action potential, that is the hallmark of genesis of cardiac electrical impulse. Refractory period. Refractory period means a period or state in which a stimulus is unable to excite or stimulate the cells. This is the refractory period. Again, there are several types of refractory period. কি refractory period থাকতে পারে? Absolute refractory period and relative refractory period. Absolute means a stimulus, irrespective of its strength, can't re-stimulate the myocardial cells. No strength of electrical stimulus can stimulate the cardiac cells or cardiac fibers. Relative refractory period, on the other hand, stronger than normal stimulus can stimulate the myocardial cells. That ARP, that is absolute refractory period, corresponds with depolarization and the early part of depolarization of the ventricles. Now, relative refractory period reads the later part of repolarization, and electrical stimulus stronger than the normal can re-stimulate the myocardium or myocardial working cells. এক্ষেত্রে দুটো কথা বলে রাখা উচিত। মায়োকার্ডিয়াম ইজ কম্পোজড অফ মায়োসাইটস। ম্যাক্সিমাম বা মেজরিটি সেলস হচ্ছে ওয়ার্কিং মায়োকার্ডিয়াল সেলস। Small portion of the myocardial cells features হচ্ছে they lack classical myofibril component known as electrical cells or electrical myocardial cells. So working myocardial cells and electrical myocardial cells, the electrical myocardial cells has got the capability to initiate impulse or automaticity, that is propagated or conducted to ventricles and activate or stimulate to contract the ventricle of excitation, contraction, coupling. Absolute refractory period and relative refractory period, দুটোর summation is the effective refractory period. রিফ্র্যাক্টরি পিরিয়ড অ্যানালিসিসের মূল কারণ হচ্ছে যখন সুপ্রাভেন্ট্রিকুলার ট্যাকিয়ারিথমিয়া অর ইএনট্রি ফেনোমেননের প্রসঙ্গ আসবে, তখন রিফ্র্যাক্টরি পিরিয়ড ইজ ভেরি ভাইটাল। Electrocardiographic correlation, relationship of ECG with action potential. Phase 0 to 1, that is QRS complex. Phase 2, that is the ST segment. Phase 3, that is the T wave. And PR, that is the conduction. Lastly, QT duration, that is the repolarization. Now, arrhythmia, again, disturbances of normal sequence of impulse initiation and propagation. I think this should be the ideal definition of cardiac arrhythmia. Disturbance or derangement of the normal sequence of impulse initiation and propagation. This is cardiac arrhythmia. Already stated, cardiac arrhythmia can be categorized bradyarrhythmia or tachyarrhythmia. Classification of arrhythmias. আউটলাইনে বলা হয়েছিল ফিজিওলজি অফ নর্মাল কার্ডিয়াক রিদম, তারপর বলা হয়েছিল প্যাথোফিজিওলজি অ্যান্ড মেকানিজমস অফ এরিথমিয়াস অ্যাজ ওয়েল অ্যাজ ক্লাসিফিকেশন অফ এরিথমিয়াস. Now arrhythmia, heart rate less than 60 beats per minute, bradycardia, তার subcategorization heart block or simple bradycardia. Heart rate more than 100 beats per minute leads to tachycardia that has got two part, narrow complex QRS tachycardia or wide complex QRS tachycardia. Narrow complex QRS tachycardia means atrial flutter, supraventricular tachycardia, and sinus tachycardia. Sinus tachycardia is VT, supraventricular tachycardia or atrial flutter. তার সঙ্গে যোগ হতে পারে multifocal atrial tachycardia, focal atrial tachycardia, atrial fibrillation, and the wide complex QRS tachycardia that has been categorized into VT or VF, that is a ventricular tachycardia and ventricular fibrillation. Now, mechanisms of arrhythmia. Arrhythmia can result from three distinct separate mechanisms or a combination of these. Number one, increased automaticity. Number two, triggered automaticity or triggered activity. Or number three, the defect in impulse conduction that is again is due to re-entry conduction block or accessory tract pathway. So, electrical dysfunction, the classical mechanisms altered automaticity. What is automaticity? Ability of a cardiac cell to initiate cardiac impulse that may be physiological or pathological. What is triggered activity? After depolarization, certain oscillations can damage the myocardium. Oscillations may occur during the early phase of repolarization, that is the phase 3, or after completion of the repolarization, that is the phase 4. So, the extra oscillations of the myocardium, that is the triggered activity, that is of two types, EAD, early after depolarization and delayed after depolarization. Early after depolarization occurs in phase 3 and delayed after depolarization occurs in phase 4. This is the triggered activity. Examples, digoxin toxicity produces arrhythmias or atrial tachycardia, a classical example of triggered activity. তাছাড়া catecholamine, cardiac pacing or drugs may produce triggered activity, as well as hypoxemia, dyselectrolytemia may produce triggered activity. And defect in impulse conduction subcategorized into three separate mechanisms or machinery like re-entry, conduction block, or accessory tract pathway or bypass tract pathway. Now, what is accessory tract pathway or bypass tract pathway? Accessory tract pathway আর একটা নাম হচ্ছে bypass tract. What is the role of bypass? Bypass এর role হচ্ছে it bypasses the normal physiologic delay in the conduction system, producing early and faster rate of the ventricle. So bypass tract or accessory pathway main role is bypasses the normal physiologic delay in the conduction system. Altered automaticity, physiological, that is due to beta 1 stimulation or vagal stimulation. Pathological, escape rhythm or ectopic rhythm. What is escape rhythm? Due to failure of the sinus node to produce impulse or delay in the genesis or generation of the cardiac impulse. তখন lower pacemaker, that means AV junction or his Purkinje system, take over the charge. This is the escape. That means escape from the higher control of the conduction machinery. And what is ectopic rhythm? That means abnormal focus for generation of impulse. Triggered activity or automaticity and after depolarization. Extra oscillation damaging myocardial cells after depolarization have been completed may produce triggered activity that is a substrate for the genesis of arrhythmias. Interruption of normal action potential. Normal action potential is followed by an abnormal depolarization. Phase 0, phase 1, phase 2, phase 3. Phase 3 depolarization বলা হয় early after depolarization, and stage D, this is the delayed after depolarization after the completion of stage 3. Show extra oscillation or abnormal oscillation known as after depolarization after reaching a critical threshold produces abnormal rhythm, that is arrhythmia, due to triggered activity or triggered automaticity. EAD, early after depolarization, common when heart rate is slow, seen in condition of marked prolongation of the action potential. Whereas delayed after depolarization, when the heart rate is rapid, seen in condition of intracellular calcium overload, like digoxin toxicity. Now, re-entry phenomenon. রি-এন্ট্রি কথার মধ্যেই লুকিয়ে আছে নতুন করে আবার ইম্পালস ঢুকে যাচ্ছে। The basis of re-entry phenomenon means a circuit that may be functional or anatomical in the myocardium. Functional or anatomical circuit that is divided into two pathways, one fast pathway and a slow pathway. Second, a slow pathway with slower refractory period and the first pathway with the longer refractory period. And there must be a unidirectional block. So substrate or base of re-entry phenomenon is electrophysiological inhomogeneity in the anatomical or functional circuit with conduction delay in one pathway and unidirectional block in another pathway constitute the basis of the anatomic substrate and produces the re-entry phenomenon or circus movement that is a method for the genesis of cardiac arrhythmias. For example, atrium, alpha slow pathway. Here, this is the conduction delay and this is the unidirectional block. The second picture, this is the conduction delay and this is the re-entry of the electrical impulse to activate and produces the circus movement or arrhythmia. Accessory tract. Accessory tract সাধারণত তিন রকমের হয়. Classical is the bundle of Kent. Second is the Mahem fiber. And third is the James bypass tract. Bundle of Kent originates in the atrium and ends in the ventricle. Bundle of Kent bypasses the normal physiologic delay in the AV node. And bundle of Kent features হচ্ছে a first activation through the accessory pathway, second activation through the normal conduction pathway produces a fusion complex that has got classical features in the ECG like number one, delayed upstroke of the QRS complex, initial slurring or delta wave in the upstroke of the QRS complex, normal or near normal configuration of the QRS complex and secondary STT change. Bundle of Kent is commonly associated with the organic heart disease and it is mainly a classical feature most commonly associated with Epstein's malformation. And the James bypass tract. James bypass tract originates in the atrium and ends in the his bundle. That means the ECG features is short peer interval but QRS complex is normal because the rest of the ventricle is activated by the common pathway. And lastly, the Mahem fiber that originates below the AV junction that is in the his bundle and ends in the ventricle that produces no delta wave or no short peer interval. ভুল বললাম, that produces no short interval but delta wave. So difference between bundle of Kent and Mahem fiber is the presence of delta wave but no short peer interval. So repeat. Bundle of Kent, short peer interval, delayed upstroke of the QRS complex, presence of the delta wave, normal or near normal configuration of the QRS complex, and terminal STT changes that is secondary. Mahem fiber, short no short fear interval, presence of delta wave, and the near normal configuration of the total QRS complex as well as secondary STT change. এখানে একটা কথা বলে রাখা ভালো, WPW syndrome. Excitation by means of bundle of Kent is known as pre-excitation. But history of palpitation and evidence of tachyarrhythmia plus evidence of pre-excitation in surface ECG, all these three constitute Wolff-Parkinson-White syndrome. শুধু বান্ডেল অফ কেন্ট বলি WPW সিনড্রোম বলা যাবে না। সিমটমস প্লাস ট্যাকিয়ারিথমিয়া প্লাস এভিডেন্স অফ প্রি এক্সাইটেশন, এই তিনটের কম্বিনেশনকেই বলা হয় WPW syndrome. Now, sinus arrhythmia is a normal phenomenon, fluctuation of autonomic tone results in fluctuation in heart rate with respiration. In inspiration, parasympathetic tone falls and the heart rate increases or quickens, whereas during expiration, the heart rate falls. This is a classical ECG picture of sinus arrhythmia. Everything is normal, P, QRS complex, ST segment, but the rate is variable. The first one is shorter, that is the tachycardia. Second one is the longer, that is the bradycardia. This is the phase of inspiration and this is the phase of expiration. Now, bradyarrhythmia. Bradyarrhythmia can be due to dysfunction. কি কারণে হতে পারে? এক নম্বর কারণ হচ্ছে যদি এসএ নোডে সমস্যা থাকে তাহলে, এবি নোড বা এবি জাংশনের সমস্যা থাকে তাহলে, অথবা যদি হিস পার্কিনজি সিস্টেমে সমস্যা থাকে তাহলে, অর্থাৎ সাইনো অ্যাট্রিয়াল নোড বা এসএ নোড, এভি নোড বা এভি জাংশন আর হিস পার্কিনজি সিস্টেম বা ইনফ্রাহিস, এই তিনটে লেভেলে সমস্যার জন্য সাইনাস ব্র্যাডিকার্ডিয়া তৈরি হতে পারে। এসএ নোডের জন্য সাইনাস ব্র্যাডিকার্ডিয়া যেটি হয় সেটি মেনলি হচ্ছে যে ক্রোনোট্রপিক ফেলিওর, অর্থাৎ ডিক্রিজড অটোমেটিসিটি। Sinus bradycardia manifests as a slow sinus rate, can occur at rest or as a chronotropic response due to decreased automaticity. Sinus bradycardia cause extrinsic factors or influence as well as intrinsic factors, that is in the SA node or surrounding atrium. Extrinsic factors that influence a normal sinus node are intrinsic sinus nodal disease. এটা আস্তে আস্তে আসার চেষ্টা করছি। Common cause of extrinsic: hypothermia, hypothyroidism, cholestatic or obstructive jaundice, and raised intracranial pressure. Drug therapy with beta blocker, digitalis, calcium channel antagonist, and various other anti-arrhythmic drugs. And neurally mediated syndromes, এটার প্রসঙ্গে পরে ডিটেলসে আসবো। So extrinsic factors: hypothermia, hypothyroid, cholestatic jaundice, increased intracranial pressure. Drug therapy with beta blockers, digitalis, and other anti-arrhythmic drugs, including calcium channel blockers like verapamil, diltiazem. And lastly, neurally mediated syndromes. Intrinsic cause, acute ischemia and infarction of the ASA node or surrounding atrium as a complication of acute myocardial infarction. Secondly, chronic degenerative changes involving the sinus node as well as the surrounding atrium, that is the sick sinus syndrome. Now, sick sinus syndrome is most important. তার আগে ছোট্ট করে বলে নিয়ে আগেই বলেছিলাম নিউরালি মিডিয়েটেড সিনকোপ বা নিউরালি মিডিয়েটেড syndromes. Neurally mediated syndromes are due to a reflex reaction known as basal Jerry's reflex that produces sinus bradycardia, sinus arrest or sinus exit block and AV block and reflex peripheral vasodilatation. So sinus bradycardia and peripheral vasodilatation are the cornerstone of neurally mediated syndromes that may present with syncopal attack or presyncopal attack or dizziness. Types: carotid sinus syndrome mainly occurs in elderly and lead to bradycardia. Neurocardiogenic syncope or vasovagal syncope in response to stress, either emotional or exertional, like prolonged standing, may produce syncopal attacks as a result of either bradycardia or peripheral vasodilatation or a combination of these two. And lastly, the postural orthostatic syncope or POTS, a sudden and substantial increase in the heart rate associated with normal or mild reduction in blood pressure. The underlying mechanism is inability of the peripheral vasculature to respond adequately to orthostatic stress, that is the sudden standing. Sick sinus syndrome cause. Most common cause is idiopathic fibrosis. তাছাড়া বাকি কারণগুলোর মধ্যে থাকতে পারে ইসকেমিক ডিজিজ, কার্ডিওমায়োপ্যাথি অ্যান্ড মায়োকার্ডিটিস। ফিচার্স অফ সিক সাইনাস সিনড্রোম, কী কী নিয়ে সিক সাইনাস আসতে পারে? Simply sinus bradycardia with an unusually low heart rate, even less than 45 beats per minute. Secondly, sinus exit block that may be first degree, second degree, or third degree, or even higher block. Third, sinus arrest. Fourth, tachybrady syndrome. And fifth, chronotropic incompetence. So features of sick sinus syndrome: sinus bradycardia, sinus exit block, sinus arrest, tachybrady syndrome, and chronotropic incompetence, as well as AV block. Again, first degree, second degree, and third degree. Sinus exit block অর্থাৎ এস এ নোড ইম্পালস তৈরি করছে কিন্তু সারাউন্ডিং অ্যাট্রিয়ামে কন্ডাক্ট করতে পারছে না। দিস ইজ আ ফর্ম অফ ব্লক, অর্থাৎ এস এ ব্লক। এক্সিট ব্লক অর্থাৎ সাইনাস নোড থেকে অ্যাট্রিয়ামে এক্সিট করতে পারছে না। ফার্স্ট ডিগ্রি এস এ ব্লক, দ্যাট মিনস ডিলে। সারফেস ইসিজিতে কিন্তু ফার্স্ট ডিগ্রি এসএ ব্লক রেকগনাইজ করা যায় না। সেকেন্ড ডিগ্রি এসএ এক্সিট ব্লক, তার দুটো টাইপ আছে, টাইপ 1
এই
টাইপ
7-11
টু। টাইপ 1 হচ্ছে
9 থেকে
প্রোগ্রেসিভ
10
PP shortening preceding the sinus pause.
ওটা
The
মনে নেই
PP
এখন
interval
বুঝতে পারছেন
following the pause must be
ওটা দেখে বলতে
greater
হবে তোকে বলেছিলাম
than
ওই যে সিবিএমইটা
twice
ডাউনলোড
the
করে
PP
প্রিন্টার
interval
হয়েছে সিবিএমইটা
that preceded the
তো ফাইল
pause.
করে রাখবে
পরে আমি দেখাচ্ছি। Type 2, a pause equaling an exact multiple of the pause or multiple of the preceded or followed PP interval. There is constant PP interval before and after the pause. And third degree is exit block, absence of multiple waves. And lastly, sinus arrest, no P wave is visible. Third degree is a block, results in complete absence of the sinus P wave. এর মধ্যে ফার্স্ট ডিগ্রি এস এ ব্লক ইসিজিতে রেকগনাইজ করা যাবে না। ইলেকট্রোফিজিওলজিক্যাল স্টাডি ইজ এসেনশিয়াল। এস এ ব্লক গ্রেড 2 অ্যান্ড টাইপ 1। গ্রেড 1 সম্পর্কে বলা হয়েছিল যে সারফেস এসিজিতে আসা যাবে না, সেই জন্য আলোচনাতে যাচ্ছি না। এক্ষেত্রে তোমরা লক্ষ্য করে দেখো যে PP interval, this is the normal PP interval, and this is the PP interval following the pause. This PP interval is greater than twice the normal PP interval, greater than twice the normal of the PP interval. Grade 2, type 2, PP interval, and again this is the PP interval. This PP interval অর্থাৎ ফলোইং দ্য পজ যে পিপি ইন্টারভেল আসছে বা ব্লকের পর যে পিপি ইন্টারভেল আসছে সেই পিপি ইন্টারভেল ইজ দ্য মাল্টিপল অফ দিস পিপি ইন্টারভেল অর দিস পিপি ইন্টারভেল এক্স্যাক্টলি ইদার ডাবল অর ট্রিপল. So this should be the multiple of the preceded or constant PP interval after the block is not visible. Grade 3, multiple absence of the P wave. So grade 2, type 1, grade 2, type 2, grade 3. This is the SA block. And sinus arrest আমি আসছি না, কারণ sinus arrest total absence of the P waves. Management of sinus bradycardia, identification of the reversible or extrinsic factors, and the control or correction of the extrinsic factors may restore the sinus rhythm. কিন্তু যদি ট্রাভেলসাম আর ডিসেবলিং সিমটমস অ্যারাইজ করে তখন টেম্পোরারি পেশিং ইজ ইন্ডিকেটেড, যে কতক্ষণ আর যতক্ষণ নর্মাল সাইনাস রিদম ফিরে আসবে। কিন্তু ক্রনিক ডিজেনারেটিভ সাইনাস নোড ডিসফাংশন লাইক সিমটোম্যাটিক সিক সাইনাস সিনড্রোম should be treated by permanent pacemaker, especially triple DR pacemaker. What is triple DR pacemaker? ট্রিপল ডিআর পেসমেকারে কয়েকটা টাইপ আছে, ভিভিআই, ডিডিআর, ট্রিপল ডিআর। ডি ফর ডুয়াল চেম্বার সেন্সিং, ডি ফর ডুয়াল চেম্বার পেসিং, ডি ফর dual action, that means mode of inhibition or mode of excitation or stimulation, and R means rate responsive, that is related to the respiration rate or metabolic needs. The pacemaker would function accordingly. So symptomatic chronic sick sinus syndrome should be treated by dual chamber pacemaker, especially triple DR. Carotid hypersensitivity syndrome, usually with a duration of asystole or sinus pause exceeding 3 seconds, and symptoms are reproduced by carotid sinus messes, and the patient is in distressing or troublesome condition. The indication is pacemaker. But pacemaker implantation has got some sorts of disadvantage like ICD or anti-arrhythmic therapy, but dual chamber pacemaker, especially triple DR, resolves all the problems. এখানে একটা কথা বলতে ভুলে গেছি, ক্রনিক সিমটোমেটিক সিক্স সাইনাস সিনড্রোমে বলেছি পার্মানেন্ট পেসমেকার ইজ এসেনশিয়াল, দুটো পয়েন্টের কথা বাদ দিয়ে চলে গেছি। কি কি? নাম্বার ওয়ান, ট্রিপল ডিআর পেসমেকার বসানোর পর ক্রনিক সিক্স সাইনাস সিনড্রোমের ক্ষেত্রে কখনো কখনো এরিথমিয়া দেখা দেয়, লাইক ট্যাকি ব্র্যাডি সিনড্রোম। দ্যাট মিনস ইনিশিয়েশন হচ্ছে একটা ট্যাকিকার্ডিয়া বা ট্যাকি এরিথমিয়া, অ্যাব্রাপ্ট অনসেটের পরে ব্র্যাডিকার্ডিয়া ডেভেলপ করছে। দিস ইজ এ ফিচার অফ সিক্স সাইনাস সিনড্রোম। সো permanent pacemaker in the form of triple DR can alleviate the bradycardia component, but what about the tachycardia component? So we need additional therapy in the form of anti-arrhythmic therapy or ablation therapy of the AV junction in order to prevent the tachycardia episode of six sinus syndrome. এবার এভি ব্লক, আগে বলেছিলাম এস এ ব্লক, এবার আসছি এভি ব্লক। All atrial impulses are conducted to the ventricles. First degree AV block means prolongation of the PR interval, that is delay in conduction. Second degree AV block, two types, type 1 Mobius type 1 or Wenckebach phenomenon, and Mobius type 2. Mobius type 1 means gradual prolongation of the PR interval followed by drop of the P wave or inability of P wave to conduct to the ventricles. And the Mobius type 2, it is the abrupt and unexpected drop of the P waves to conduct to the ventricles, usually associated with QRS complex widening. And third degree AV block, complete interruption of the conduction between atria and ventricle. Now features of complete heart block. Number one, low ventricular rate in the range of less than 40 beats per minute. Number two, rate is regular. Number three, AV dissociation. What is AV dissociation? Atrium and ventricle is activated separately and there is no relationship between these two. In normal situation, P and QRS complex are interrelated and bonded, but in AV dissociation there is the electrical divorce or electrical divorce because P or atrial activation and ventricular activation is independent and there is no relationship. And lastly, atrial rate is greater than ventricular rate. So features of complete heart block: regular rate, bradycardia in the range of heart rate less than 40 beats per minute. Number 3, AV dissociation. And number 4, কি বললাম, rate regular, atrial rate is greater than ventricular rate. So this is the complete. Now ECG manifestations. Grade 1, this is the prolongation of the PR interval, delay in conduction. Grade 2, type 1, PR interval, prolongation, drop. Gradual prolongation followed by inability of UF to conduct ventricles. Grade 2, type 2, P, sudden and unexpected drop, and grade 3, P, and P. But there is no relationship between the QRS complex and P complex. The QRS complex is regular, atrium is regular, total rate is regular, no relationship between the QRS complex and P, and the atrial rate is greater than the ventricular rate. AB dissociation কোথায় কোথায় দেখা যায়? তিনটে কন্ডিশন: কমপ্লিট হার্ট ব্লক, নাম্বার 1; নাম্বার 2, junctional rhythm of ventricular tachycardia; আর নাম্বার 3, sinus default. The repeat, AV dissociation can occur is number 1, sinus default; number 2, usurpation; number 3, ventricular or junctional tachycardia; and lastly, complete heart block. Supraventricular tachyarrhythmia. Supraventricular tachyarrhythmia আগেই বলা হয়েছিল অরিজিন ও অ্যানাটমিক সাবস্ট্রেটের উপর বেস করে supraventricular tachycardia ডিফাইন করা হয়. That is the tachycardia above the AV node or AV junction. Supraventricular tachycardia ক্ষেত্রে দুটো ভাগে ভাগ করা যায়: ন্যারো কমপ্লেক্স QRS tachycardia or wide complex QR tachycardia. Classification is versatile এবং variable. Atrial tachyarrhythmia and AV tachyarrhythmia. Classification: sinus tachycardia, inappropriate sinus tachycardia, sinus nodal reentrant tachycardia, atrial tachycardia, multifocal atrial tachycardia, atrial flutter, atrial fibrillation. And tachyarrhythmia, AV tachyarrhythmia, AV nodal reentrant tachycardia, AV reentrant tachycardia, junctional ectopic tachycardia, and non-paroxysmal tachycardia. Pathophysiology, again, automaticity, triggered activity, and the re-entry are responsible for genesis of tachyarrhythmia, especially supraventricular tachyarrhythmia. আজ এই পর্যন্ত থাক। থ্যাংক ইউ। অনেক বাকি আছে।